So let's take a look at the software. I've installed it on your computer here, and on the desktop is a Florida Probe icon. Now it will also bridge to all the major practice management softwares. We're going to take a look at it as a standalone. I click on the Florida Probe icon.
Welcome to the Florida Probe.
Now I want to hear that welcome. If I don't hear that welcome, then I want to stop and figure out why. Either my speakers are turned off or unplugged, they're muted, but the sound is a very, very important part to it for two reasons. Number one, it helps keep me on track during the exam so I don't end up with extra pockets or extra teeth. And also, the authoritative computer is delivering the message to the patient. You're not enunciating it. The authoritative computer is. And that's the interesting human dynamic. When the computer delivers it, the patient becomes more engaged. Now I'm going to take a very systematic approach to this and created this flow chart. I call it Florida Probe step by step. That'll guide you through the various steps. And this, it was in your user's manual, is a good reference tool. Okay. So the first thing I need to do is to identify my patient. If I have bridged from my practice management software, it's going to give me this information, last name, first name, and chart number. If I'm do a standalone, the first time I see this patient, I want to do new patient. Click on the new patient icon. Now, all that I need on this page, and I'm just going to use myself as the patient. All that I need is enough to identify the patient. Last name, first name, and a unique identifying number. If in your practice you use a chart number, if you use date of birth, if you use social or some other identifier, that's fine. Just enough to identify this Mrs. Jones as opposed to another Mrs. Jones. Okay? And I will click on gender. Now, I'm going to use my date of birth because it's going to flow through to our periodontal risk assessment. So step one is simply to identify the patient. Launch Florida Probe and identify the patient. Step two, there's a heart icon here. This is our periodontal risk assessment. And this is really a query of inherent risk for the patient. So based upon their systemic health, diabetes, immune suppression, Down syndrome, things like that, their smoking habits, behavioral and temporary, pregnant, orthodontia, bruxism, xerostomia. You can do a quick evaluation of their oral hygiene and any medications that they might be taking, as well as their genetic predisposition for periodontal disease, diabetes. If you're testing for the presence of pathogenic microbes, this is a big indicator. And it is always a function of age. For example, the average molar tooth length is 15 millimeters. If when we conduct the exam, we have the maximum pocket depth or clinical attachment loss of 7.5 millimeters, that's 50% of the tooth length. 50% of a 50-year-old patient is the median. If that were a 100-year-old patient, he's in great shape. If it's a 25-year-old patient, he's in very bad shape. So the age is a very important factor here. The bottom part of this graph, we've just collected by the query. The top will be filled out by the exam, the actual probing, and we'll come back to this and look what value this has for us. Any questions about the risk assessment?
No.
The real value here is in the query. Yes, you have a lot of this information already recorded in your practice management software, but the value is in having the conversation with the patient. If a patient were to ask you, what does diabetes have to do with my mouth? What a powerful conversation to have. Rather than you saying, you know, there's a relationship between diabetes and your mouth. I know from my family history, they don't want to hear that information But if I ask about it, I'm prepared and ready to have a better dialogue.